This will help us reopen and add another layer to that. How do you go out safely?
Canada's chief medical officer now advising Canadians to wear masks whenever physically distancing is not possible. That's a change from earlier federal policy that stated only essential workers should wear masks, now a recommendation to do so. The Prime Minister says he will be following the advice, announcing he will now wear a mask whenever he cannot stay 2 meters away from people. Let's talk about some of those stories in our COVID-19 headlines today with Dr. David Fisman, who is the head of the epidemiology division at the Dalla Lana School of Public Health at the University of Toronto. Dr. Fisman in Toronto this morning, and welcome to our program. Pleasure to welcome you, sir.
Thank you so much for having me on.
One of our top stories today, this whole question of masks and the policy shifting yet again in Canada at all levels of government now, the recommendation for Canadians to wear masks when they can't physically distance and when they need another layer of protection, so an additional protective measure. It's been a bit confusing, as you know, Dr. Fisman, because there's been an evolution in the position, but now that we've landed on this, can wearing masks make a difference?
It very likely can. We don't have a definitive answer, and we don't need one because we're in the middle of a public health emergency. So there's something called the precautionary principle, which is when there's very little downside to something and there's potential tremendous upside to it, and you're in a crisis, you do it, and you can gather the evidence later. There are a few different lines of evidence on masks, though. One is what you'd call ecological evidence. You look at countries that are doing very well at bending their curves, much better than Canada is doing, and those are mostly mask-wearing countries. We also look at how we've come to understand the biology of this disease. What we didn't know a couple of months ago is that there's clearly a lot of transmission of infection that happens before people have symptoms. Those people go on to have symptoms, but before they have symptoms, they're infectious, and that's different from SARS the first time round. So wearing a mask can potentially reduce transmission in two ways. It reduces the likelihood that I give it to you if I'm wearing a mask and I feel fine, but I start shedding virus. And it also may reduce the chance that you give it to me. So it potentially is sort of a twofer. Works in both directions, coming and going, and there's very little downside. I think some of the early concern related to the fact that supply chain on personal protective equipment wasn't quite secure. And I know among healthcare professionals, there was worry that if there was widespread use of surgical masks and N95 masks by the public, there'd be none in the hospital. But I think what Dr. Tam's advocating is cloth masks at a minimum, and then if you can access sort of higher grade masks, that's fine too.
Even though, I just happen to be glancing, and this is not my field of expertise, obviously, but a study out of Britain, out of the University of Edinburgh, looking at the kind of masks the public wears and finding what they called leakage jets. So you think you're protecting, and then there is some leakage. And so they were suggesting, some of the experts there, that it's more symbolic than anything else, more political than scientific or medical.
Yeah, it may be. And as I said to the House of Commons committee that I spoke to yesterday, we can have a symposium about that in 5 years and, debate the science. But we're in the middle of a crisis right now. We've been stuck with a reproduction number. That's the number of new cases per old case in Ontario of about 1 since early April. So we're not ending this thing in Ontario. There's very little downside to this. The potential upside is that if these masks work the way I think they will work, and they are taken up by a high fraction of the population, because right now no one, minimal fraction of the population is using them, it could have very important multiplier effects on what happens with this epidemic in Ontario. Do
we need to go further? Do we need to make mask use mandatory, or do we need to suggest things like gloves and goggles too to prevent eye contracting through the eyes?
Yeah. As I say, masks work in two directions, and there's good reason to believe that they'd be most impactful with this disease at preventing your virus from going on someone else. Even though folks are motivated to wear them because they think they'll protect them from other people, it's actually wearing a mask is protecting other people from you. So I wouldn't advocate eye protection. I wouldn't advocate the use of gloves for folks outside healthcare settings. No, I would advocate keeping your hands clean. that both protects you and protects others, and you can do that with alcohol-based hand sanitizer.
You mentioned you were testifying yesterday in Ottawa, well, virtually before the members in Ottawa, before the Standing Committee on Health, on the whole issue of COVID-19. And one of the things that we heard as a result of that testimony from the head of the Canadian Medical Association was that a second wave of COVID-19 is inevitable, and the healthcare system, in the president's view, cannot withstand that because the system as it exists is sick. Do you agree with that assessment?
Well, I think that's right on multiple counts. Unfortunately, it's the nature of of communicable diseases that they do tend to come in waves because our behavior and the weather and environmental conditions go up and down, oscillate in a seasonal way. That's why we have flu season. With a brand new infectious disease like SARS-CoV-2, we have very little immunity in the population. Even in countries that have purposely tried to let people get infected, most infamously Sweden, they have new seroprevalence data coming out today that says they're at about 7%. So they're way far away from where they need to be to get herd immunity. So as we try to get our economy back on its feet, we are very, very likely to experience surges in disease. Indeed, my group thinks we're already experiencing that here in Toronto. And what we need strong surveillance systems that can give us situational awareness so we know when we need to go back to social distancing, because we're probably going to have to turn that on again and off again a few times. No healthcare system withstand a full-on onslaught of COVID. We've seen that now in New York. We've seen that in London, Paris, Bergamo, Wuhan. If you just let this burn and you delay your response to it, it knocks your healthcare system over. So we've expanded in Ontario, we've expanded ICU capacity by about 1,000 beds, but that won't be enough if we don't use disease control measures to prevent people from dying unnecessarily. So it's going to have to be a combination of public health measures, common sense, good surveillance, and building capacity as much as we can.
Those are the keys
until
to
the
get
vaccine's available.
Until the vaccine, to get in front of any resurgence, which seems to be inevitable. So the whole aspect of better surveillance, you're talking about testing and contact tracing there. What are the keys there? We're talking today, Dr. Fisman, about Saskatchewan allowing anyone who wants to have a test to get a test. Ontario is far behind in reaching the numbers that it has set for its own targets. What are the main areas that we need to boost in those key areas for the future?
Well, Saskatchewan is right on. What you want to be doing is finding as much of this as you possibly can. As a colleague of mine in New Zealand says, you want to be testing anyone with a stuffy nose, basically. And they've gone a step further in Saskatchewan and said, you want to test? You got to test. That's fantastic because that's going to give them a tremendous amount of situational awareness. COVID's proven itself to be a very slippery foe, and you can't fight an enemy that you can't see. So the practice here in Ontario of turning people away from test centers when they show up and say, I feel sick, I want to test, really doesn't help you in terms of your outbreak response. You can't do contact tracing meaningfully if you're testing 5% of cases, right? And 95% of them don't get a test. They don't, their contacts don't get traced. So you do need to massively scale up testing in Ontario and in Canada. And that was a lot of the emphasis in terms of the questions from the members of Parliament yesterday.
Is that going to be possible, though? I mean, getting to the adequate testing levels that everyone's talking about has stymied virtually every level of government, every province and every region that's needed to do that. I mean, it does sound simple for something like me. How do we get to the testing level? But the reality is, how do you in fact get to the numbers you need to be at?
Yeah, I think one of the other witnesses at yesterday's committee pointed out that at this point we're lagging way behind countries like Rwanda on tests per capita. This is Canada. We can figure this out. We can do it. And we have models within Canada that show us how to get it done. Alberta has been spectacular. BC hasn't had testing issues. Saskatchewan now has enough test capacity that they're saying, come on in and get a test if you want one. I think Ontario has been a tremendous laggard. And I think that there are folks in our country who know how to automate labs, who know how to get throughput up to snuff, who know how to deal with supply chain. They may not be in government, but they need to be at the table at this point and help the province scale up. It's really important.